participants to this great guest lecture that we have today from my friend and colleague, Dr. Michelle Kelly. So, just to talk a little bit about Dr. Kelly, she is a professor and current chair in the Department of Psychology, as well as an eminent scholar at Old Dominion University. And for more than 30 years, her work has examined active duties, veteran, and family members' mental health and substance abuse over the course of peacetime as well as combat deployment. And today she's going to be presenting a little bit about her work, particularly with recent era combat veterans as they approach the challenges of dealing with what is called moral injury. Without further ado, Dr. Kelly.
Thank you very much, Dr. Mecca, for that very nice introduction. And as you can see, the title of the talk this afternoon is Moral Injury and Suicidality Among Combat Wounded Veterans. As you can see, I'm Michelle Kelly. I'm in the Department of Psychology at Old Dominion University, and I'm also affiliated with the Virginia Consortium Program in Clinical Psychology. So our program takes part in a three-school clinical psychology program, and that is Old Dominion University, our Department of Psychology, Eastern Virginia Medical School, which is right down the street from us in Norfolk, Virginia, and Norfolk State University. So I'm easy to reach. And as Dr. Mecca said, I have been studying the impact of deployment and combat on active duty military members, veterans, and their families for about 30 years now, since I came to ODU. So this particular work that I want to talk about this afternoon is on moral injury. And just to give you a context, there we go, I just need to slide down. Some of you will know, but maybe some of you are less familiar with on September 11th, 2001, the bombings of the World Trade Center and the Pentagon here in the United States took place and resulted in many deaths, and a group called Al-Qaeda took responsibility for that. And what happened immediately afterwards is this country really developed something called the War on Terrorism. And when that happened, we had already been involved in a war in Afghanistan. We also sent many, many troops to Iraq at that time and surrounding areas. In fact, over 2.77 million U.S. service members have been deployed to Iraq, Afghanistan, or surrounding areas since 9/11, so over about a 20-year period. What this resulted in is these wars have really caused a number of war veterans that now have physical and mental health problems as a result of deployment and as a result of their experiences in combat. So we really have here in the United States almost a whole new generation of war veterans. And a number of these veterans experience something called post-traumatic stress disorder. And I'm sure many of you have heard of post-traumatic stress disorder. But what that is when you experience a lot of trauma that causes you to have a lot of fear, it impacts your brain, honestly. And for some people, it really causes them to have these feelings and experiences of things like they are re-traumatized by certain kinds of noises or sounds, things like that. Sometimes they'll have very vivid dreams and they'll see things that remind them of those experiences. And it's really a very anxiety, it causes a lot of fear, kind of recreates fear in these individuals. And that, again, I mention that because that's a type of trauma that some veterans experience. But it is the cause, what really causes that, or the etiology or cause, is really fear. Okay, they've had these fear-based experiences. Now, recently, there's been a growing interest in a new type of trauma. It's called moral injury. And my lab has been doing quite a bit of research on moral injury in the last few years. And moral injury is different than post-traumatic stress disorder. And this is one thing to kind of, it's been a very big point in the literature, is moral injury occurs when you commit an act, you perpetrate an act, or you witness an event, and that violates your own moral code. So many of you probably don't think about it every day, but you sort of have a moral code or standards or beliefs by which you kind of live by. But, in this case, many victims actually experienced a trauma where they were in combat situations and they violated their own moral code. Now, let me give you some specific examples of things that may have, resulted in violating a moral code for a person that was in combat. So you go to war, and I think it's really important to realize that a lot of the recent wars that at least the U.S. has been involved in, there's been a lot of guerrilla warfare. What does that mean? So there's been a lot of fighting that took place that was not sort of traditional fighting that you might want to think about. It took place in very populated areas where people were living. There were also things like explosive devices that have always been used, but they were very common. These things called IEDs in these recent wars. And those IEDs are very dangerous. I mean, they're much more dangerous than traditional bombs. So there was a lot of just fighting that took place where it was very high stakes, it was very fast. You really didn't know a lot of times who the enemy was. There were these bombs that were all over the place, really. And they're really not sanctioned, if you will. Believe it or not, in war, there are rules of engagement. So there are sort of okay things to do and not, and there are rules about when you can engage the enemy and when you can't. And a lot of that just didn't always take place. Okay, so it was very high stakes, had to make decisions very, very quickly. And as a result of that, a lot of times military members will tell you that they weren't always certain what the right course of action was. And there were mistakes that were made. Okay. So, things that may cause somebody to violate their moral code are things like injuring or killing a child, which of course is not something you would want to do, but you have to remember that this was, a lot of the combat took place in populated areas, right? Also, there was treating civilians harshly, which again is not sanctioned. That's not okay, but some of that took place. Making a mistake that harmed somebody else. I mean, that could be something that, yes, it was a mistake, but it could violate their moral code and cause them to feel, very strong emotions. Failing to save the life of somebody. So you're in a combat situation, you're in a situation, and your buddy, okay, is injured, and you can't save them. So to give you an example, I was at a talk one time where a former medic, he was talking about how he came across two people, and they were both dying. And he said he had to make a choice. He was 19 years old. He had to make a choice. Which person does he try to save? And he made a choice, and he saved one and not the other one. Okay. And it was, that weighed very heavily on him. And it also impacted the person that he saved. That person felt a lot of guilt because he saved his life and not the other person's life. So these are the kinds of things that took place at times. And, you can see where those are very stressful and traumatic kinds of events. Other kinds of events are things like witnessing mistakes that somebody else has done, that causes an injury or somebody to die. Seeing others violate rules of combat. Again, before active duty military members are deployed in these kinds of situations, they're given a lot of training, and they are given training on, again, rules of engagement. What is okay? What is not? When can you engage the enemy, and how, and so forth. Also, many veterans reported that they saw their fellow active duty members treating civilians very harshly, with disrespect. And they also just saw a lot of destruction. And all of these kinds of things can be very upsetting. And again, it's important to realize that recent era combat veterans often reported encountering ethical dilemmas, and they didn't always know what the right course of action was. So, for example, should they fire at a child soldier? If that soldier is pointing a gun at you, what do you do? Okay. So among, for example, U.S. Marines and Army soldiers who were deployed to Iraq, 87 and 77% respectively said that they shot or directed fire at a combatant. And 65% and 48% respectively said that they were responsible for the death of a combatant. So there were just a lot of things like that that took place. And I know that some of you are saying, thinking to yourself, well, when you go to war, isn't your mission to kill other people, to kill a combatant, if that is your mission? Yes, that's right. But still, a lot of people would believe that killing is wrong. Okay, so you have a moral code, and you certainly believe killing is wrong. But you go to war, you carry out your mission, and in fact, you may be responsible for the death of somebody else. And that will haunt some military members when they come back. Okay, some veterans feel haunted by that experience, even though at that time that was what they were told to do and that was sanctioned. But still, it's a fairly traumatic experience for a lot of people. Okay, so these are the kinds of situations that may result in these very strong emotions and really cause somebody to violate their moral code. So, what happens when you violate your moral code? Okay, well, sometimes service members, they violate a moral code, but they are able somehow to make meaning of what they've experienced. So they can resolve the event. They can, think about it. They can talk to others. They can make meaning of what has happened when they see excessive distraction or whatever. But sometimes they can't. Okay, so when an individual is not able to kind of resolve what they've done, okay, or what they've seen, and with their moral code, then they may have these again very strong moral emotions and symptoms that may occur. So again, some can't and some can. Okay. Moral injury symptoms include things like feeling excessive guilt and shame over something that you've done, difficulty forgiving yourself or forgiving other people, okay? Anger, distrust, disgust, even social isolation, feeling flawed, feeling that you are morally flawed and that you're just unworthy, unlovable, and even a spiritual crisis. So you may think, why would God let something like this happen to people? Okay, why? Why did this happen to me? Okay, something like that. So these are the kinds of symptoms that can emerge. Collectively, they're known as moral injury. Again, it's a trauma, and it may not be fear-based. It's a trauma that violates your moral code. So the other thing to kind of remember is that moral injury symptoms can be directed toward yourself, or you could have moral injury symptoms directed toward someone else. So for example, if a soldier perpetrates an act and they accidentally harm a child, they may feel guilt and shame, but that guilt and shame is directed toward themselves. However, they could also, maybe they witnessed somebody make a mistake, or they witnessed somebody, maybe somebody in a leadership role did something that at the time the soldier knew was wrong, and they knew that order didn't make sense, but they followed it anyway. So it's like they didn't act, they didn't do anything at the time. It's almost an act of omission, but sometimes that causes them now, even years later, to feel anger or for distrust other people, or just a lot of negative feelings towards others that they again witnessed perform these certain kinds of acts. So what we know is that moral injury can cause very strong emotions. And what our group and many others have been really identifying is not only that it causes you these strong emotions, but it can also result in other sort of secondary or other kinds of behaviors and mental health problems. Okay. And one of those is moral injury symptoms are actually associated with suicidal thoughts and behaviors and suicidal ideation and actual attempts. So some of you may have seen in the news, but in the United States, suicide is the second leading cause of death among military personnel. And in fact, sometimes you hear it's the leading cause of death among military personnel. So in fact, we've lost more people from suicide than we have from the wars at this point. And so it's estimated that about, and it varies depending on, exactly which report you read, but it's estimated that between about 17 and 22 veterans in the United States kill themselves every day. Okay. So, and that's a pretty well established number, and it's continuing. So that's really the reason why our particular lab did this particular study. So our particular focus in this study was, we know that there is self-directed moral injury. Again, this is feelings of guilt and shame directed toward yourself. And there's other directed moral injury. This is more feelings of anger or disgust or feeling betrayed and so forth and that's directed toward other people. And we know that that is associated with suicidality, okay? So our goal in our lab, first of all, has been to kind of identify those links, those associations, but we're also been working to try to identify why is it that some veterans really, are very likely or more likely to experience suicidality and others aren't, okay? So what we've been looking for is things that are called moderators or buffers or things that may reduce that association, if that makes sense. So if you're high in things like, or higher in things like self-kindness or mindfulness or common humanity, knowing that, we are all flawed, these were the variables that we were looking at. And we were saying if you were higher in these things, we thought that that might reduce the association here between moral injury and suicidality. So that was one focus of this study. We also, again, we know that moral injury symptoms are associated with suicidality. We also wanted to look at social connectedness. So if you have friends and people you can talk to and share your feelings with and really talk about what's happened, we thought that if you were higher in that characteristic, that actually that again would reduce this association. Again, we're trying to identify what are these variables that we may be able to address that could help this relationship, that would reduce this relationship. And finally, there are also probably variables that they increase or strengthen the association between moral injury symptoms and suicidality. So for example, feeling self-judgment, if you're a person that's very high on self-judgment and you're very negative toward yourself, or over-identification. So over-identification is this idea that you really focus on your failings, on your limitations, on your flaws, on your mistakes. We thought that these two types of variables, if they're higher, soldiers are higher on these things, veterans are higher on these things, this would be that would strengthen that association. So these would be things that would be important in the future to really look at if that in fact is the case. All right. So those were that is what we were doing in this particular study. Here you can see we're moving into our methods and participants and so forth. Our participants in this particular study were 189 combat veterans. They were members of something called the Combat Wounded Coalition. And the Combat Wounded Coalition, these are individuals that apply to be part of this group, and they're all combat wounded, meaning that they have been wounded in combat, okay? And the vast majority of them actually received something called the Purple Heart, which is a medal for individuals who, in fact, were wounded in active duty in a war. So again, we focused on that group because we felt that there would be a lot of moral injury and that they would have, lots of experiences of being in a war zone and so forth, and maybe lots of feelings around their experiences. So these were our participants. And also by being part of this group, we knew in fact that, we knew their service records and we knew that they had in fact served in the vast majority in recent era wars. And as you can see, all of these participants had deployed at least one time. The vast majority had deployed multiple times. And most of them, almost all of them, had been deployed to recent wars in Iraq or Afghanistan. Some had been deployed to other wars. Most of them were male because most boots on the ground kind of veterans, in fact, are male right now, although not all. Okay. Participants lived in one of 36 states in the United States. The mean age was 43. And most had been in the Army or in the Marine Corps. And those are the branches that are most likely to actually go into a boots on the ground war type situation, okay? Particularly Army members. There are lots of them. So these were our participants. And they completed a survey. So we mailed them an anonymous survey. We made it very clear, this was by email, and we invited them to participate. And we made it very clear that we weren't part of, the Department of Defense here or anything like that, and that their data would be anonymous. That is, no one else would know that they participated, and we wouldn't identify their names or anything like that with their responses. And they completed a number of survey measures, and one of them is called the Expression of Moral Injury Scale, developed by Joe Curry and his colleagues in Alabama. And it really measures two types of moral injury: self-directed moral injury. And you can see here are samples I'm ashamed of myself. Okay, that's the focus. Or other directed moral injury. For example, when I look back on my military service, I feel disgusted by things that other people did. So that is why we chose that measure, that it really looks at self-directed moral injury and other directed moral injury. So we could tease those apart. They also completed a measure that kind of collectively is known as self-compassion. So it measures actually a number of different dimensions. So we gave all of these. It measures self-kindness. So for example, when I'm going through a hard time, I give myself the caring and tenderness I need. That was one item. Mindfulness. When something upsets me, I try and keep my emotions in balance. Common humanity. When I feel inadequate in some way, I try to remind myself that my feelings of inadequacy are shared by most people. Self-judgment. I'm intolerant and impatient toward myself, those aspects of my personality that I don't like. And over-identification. When I fail at something important to me, I become consumed by feelings of inadequacy. So you can see that this measure really does map on to the types of things that we've just talked about. Another measure that we gave is something to get at social connection, is really a friendship scale or social connection. So sample items include, it's been easy for me to relate to other people, and I've had somebody to share my feelings with. And finally, we also gave a suicidality questionnaire. So we gave a subscale of something called the IDES, the Inventory of Depression and Anxiety Symptoms. We gave the suicide scale. I had thoughts of suicide, and I hurt myself purposely. These were assessed for the last month. Okay. I know this is a lot, so don't get overwhelmed. I'm not going to go through every single thing in this table, but let me just take you through a few things so you can kind of follow along and look at this in a little bit more detail later. So if you look at column number 1, okay, this is sort of the association, or maybe look at here, this 0.80. What does that mean? This is the association between their self-directed moral injury scores and their other directed moral injury scores. You can see it's really high. So when they're reporting self-directed injury, they're also reporting often other directed moral injury. If you continue to go down this first column, you'll see what kind of we expected, which is just in terms of, associations, this association between the variables. You'll see that self-directed moral injury, when they said, I have guilt, I have shame, etc., when they were higher in that, they also reported lower self-kindness, but higher self-judgment, okay, which kind of makes sense if you think about it. So if they're experiencing a lot of this guilt and shame, in general, they're reporting lower self-kindness, more self-judgment, more identification with their failings, and less social connection and more suicidality. So if you kind of go through each of these individually, what you'll see is a pattern where in fact people that were harder, so to speak, on themselves and didn't have some of these variables like self-kindness or judgment, or I'm sorry, mindfulness, in fact, reported, higher self-directed and other directed moral injury. And the variables, if they're bolded, those were meaningful or what we call statistically significant. If you look over here in these columns, over on the very right-hand side, my right-hand side anyway, you'll see a mean and a standard deviation for these different variables. So perhaps if you want to go look these up or get a better idea, you can look these up and see what does this mean? Is this a high score or a low score or something like that? We also looked at things like number of months deployed and years in the military just to see if those would be important variables to consider in our models. So getting to the results and summary. So again, just to reiterate, our study aims were to understand risk and protective factors or variables that may help us understand this relationship. And again, may help us understand why this association is stronger or weaker for certain individuals. So why is it, that some individuals, when they experience these things, they are reporting more suicidality and other people are reporting less, they have the same experiences, in some cases, less suicidality. So self-directed moral injury and suicidality were strengthened, or that link there between self-directed moral injury and suicidality was stronger for people that reported, veterans that reported over identification. So if these were individuals that reported that they were very high in identifying with their failings, their shortcomings, their flaws, these individuals, that strengthen that association, if that makes sense. We also found a couple of other findings that were positive, so to speak. So other directed moral injury and suicidality, that should be self-directed moral injury. Self-directed moral injury and suicidality weakened, okay? So was reduced for individuals that reported higher mindfulness, okay, and higher social connection. So if you had more friends and others you could relate and talk to and so forth, that reduced that association. The same thing with mindfulness. As a whole, individuals higher in mindfulness, that was associated with lower link here between self-directed moral injury and suicidality. So those were our findings. Also, if you're interested, I can send you a copy of this paper that was just published. So kind of stepping back now and thinking a little bit about it, why is this study important? Why is this important? Well, I hope that it's evident why it's important. But, when combat veterans report moral injury symptoms, and there's been more and more work saying that, not all trauma is the same. And, certainly some people can experience post-traumatic stress disorder, but other veterans experience moral injury symptoms, or sometimes both. So when combat veterans experience moral injury symptoms, such as over-identifying with their failings and their limitations, their flaws, mistakes they've made, that is something that could be really addressed in traditional therapy, or perhaps in less traditional therapies, and I'll talk about that in just one second. But when we think about traditional therapy, most of us think of face-to-face therapy with a counselor or a psychologist, or maybe these days telehealth, right? So you're, on the phone, or you're on Zoom or WebEx or whatever with a mental health professional. So that's more of a traditional therapy. But again, I want to talk about less traditional in just one second. We also found that mindfulness and social connection really may benefit combat veterans who report more moral injury symptoms. So I think this is another opportunity for teaching mindfulness and really emphasizing for combat veterans supported connections and helping them in some cases learn how to do that and, make these connections with others and maintain these connections, that may benefit veterans with moral injury symptoms. Future directions, and I know I've covered quite a bit here, but our lab, so my lab here at ODU, and the students and my collaborators and I, we are really now working, we've sort of been looking at this puzzle, if you will, of moral injury. What is it exactly? How is it associated with negative mental health symptoms in many cases? And, where do some of these variables fit in? And now what we're doing is we're trying to work on two non-traditional therapies. One is mindfulness, and I know many of you have heard of mindfulness training and you know what that is, and perhaps you practice mindfulness, but we're working on mindfulness training for veterans with moral injury. And we believe that developing mindfulness training for veterans may allow veterans to let go of some of these negative thoughts and, ruminating or obsessing or really thinking a lot about these mistakes that they've made, and maybe even move into greater acceptance, and maybe even be able to forgive other people that they feel, have made mistakes, and they feel anger and so forth toward these individuals, but realizing that sort of, we're all flawed, so to speak. Another thing we're doing in a study we call the Moral Elevation Study, which we are just starting, and we are trying to see if this might work. We're showing moral elevating videos. What does that mean? We're showing very positive videos daily. So people performing sort of selfless, pro-social, helping acts, altruistic acts, acts that, they don't actually expect to benefit themselves. But we're showing sort of videos like this, especially of veterans performing these kinds of acts. So, our veterans can kind of relate to some extent to somebody who's been in a situation like they've been in, and then they've come back and they're doing, really helpful things to people like providing meals, etc. So we're hypothesizing, hopefully, that, we'll see, to be determined. We're empirically studying this, but we're hoping that showing these videos may help people, again, to sort of let go of some of this moral injury symptoms, feel more positive, so reduce some of the negative emotions that they're experiencing. So that's a couple of the ways, and again, these are what I would call, anyway, non-traditional treatments for veterans. So it doesn't involve necessarily coming into a VA hospital, a Veterans Administration hospital. Hopefully these are things that, if they work, that can be provided fairly easily and, very inexpensively to veterans that are all over the place. So we'll see, okay? So stay tuned. I guess that's the way I look at it. But I would like to thank, first of all, again, the REYES program for putting this together and inviting me. I appreciate that. And the American Psychological Association Division 19, which is Society for Military Psychology. If any of you out there are interested in military psychology, I strongly recommend joining this division. Certainly international people can do it. And it is free for the first year, okay? So it's free, and it's honestly only $10 a year for students. And you'll learn all about military psychology. Also, and they gave us a little bit of money. We gave veterans that participated $10 if they wanted it, $10 in Amazon credit. One of the things I've learned about Amazon is no matter where you are in the world, at least people on ships would tell me when they got to port, that package was there if it was delivered by Amazon. So they like Amazon, gift cards, right? So I'd also like to thank those participants that took the time to participate in the study. Again, these were members of the Combat Wounded Coalition. And very importantly, my lab and lab members, my collaborators and lab members on this particular project are my students and former students. And they're all wonderful and have been very, very helpful in this work that we're doing in this particular line of research on moral injury. The best way to contact me by far is if I can't get to your question today or something pops up later, is just to email me. So I'm always on email. So I think my time is up, and I believe it's time to turn it back to our facilitator and moderator, Dr. Mecca.
Thank you, Dr. Kelly. That was a great talk. We currently only have one question, but we may have other questions coming in. And this one's a really interesting one. And I'll present the question, then also kind of try to generalize it beyond that. But Hayes, and I apologize if I mispronounced that, from Puerto Rico, writes, because of reoccurring events that have led to the Black Lives Matter activist movement, has moral injuries developed as a result? For example, protesters seeing other protesters being hurt by officials, officials needing to control violent protests and accidentally harming protesters?
That's an excellent question. I think it's really important to realize that moral injury does not just occur in veterans at all. Okay. So we know that moral injury occurs in a lot of other groups of people. Okay. So I absolutely think it could occur, okay, where you can feel something they've done is part of a protest or that you've seen done, especially could cause you to experience moral injury. So you just don't understand, you have this view of sort of what's right, wrong in the world, and all of a sudden that view is just violated. Absolutely, I think that can cause moral injury. I have not seen any research on that yet, but I just want to also mention there are a lot of professions that experience moral injury. Things like if you're police, if you're a first responder, so you're a person that's an EMT, emergency medical personnel, if you're a frontline, emergency doctor, something like that, or nurse, these are professions, even journalists, okay? So, but there's been a lot of attention recently in healthcare providers, but I definitely think that moral injury is a concept that can absolutely apply in a lot of different situations. And I think there's just, so far I haven't seen anybody do it, but I think it would be important to study. Good question.
It seems like you already anticipated where I was going to ask as a follow up to talk about other fields where this might apply to. So we don't have any questions from the audience, but I think it might be good, because I to just kind of elaborate as to what mindfulness training looks like and what that is, since you mentioned that as a possible intervention for veterans.
Mm-hmm. What we're kind of thinking about is there are lots of mindfulness, slightly different programs, if you will. And some of them are longer or shorter, something like that. And you can probably go online. Most of these are freely available. But the one that we're thinking of, one of the things we've learned, and one of the things the literature seems to show, is that people don't want really long therapies. They want something that they can, learn how to do quickly. So with mindfulness, what we're thinking of is like a 6-session program. So you call in, you Zoom in or WebEx in with several other veterans once a week, and you learn these simple mindfulness exercises, and they are simple. Like one is just mindful eating, just paying attention really to what you're eating and when, what's going on. And another one is mindful walking. So what I mean by that is just paying attention to what's going on, but also as things happen to you, not just judging them. So again, think about this veteran who's had a lot of negative experiences. Instead of all of a sudden a thought comes back about something that they did, a failing or something that they had while they were in a war zone, rather than dwelling on that or just, thinking about it and going down that rabbit hole, so to speak, just, let it come in, don't judge it, and let it go back out and stay focused on this moment in time, right? So it's bringing your awareness back to the present moment and learning to kind of let go of a lot of those feelings of judgment, those thoughts of judgment, and just staying focused. It is proposed to really help people with just acceptance and just, again, greater compassion for other people. So that's why we think that this kind of simple program, and again, imagine sort of 6 different exercises that you may learn and practice over the course of a 6-week session that, and then you have this toolbox, so to speak. So, you can just start to practice, whatever kind of makes sense at that time. So if you're walking or if you're going to class, okay, or something like that. So that's how it works. Ellen, I think you're muted.
Thank you for that. There's still no new follow-up. There's no new questions from the audience, but just one last question on my end. And if we don't get any other questions, we can conclude the session. But what do you think are some future avenues of research? I mean, you talked about the intervention piece, but what are other things that we don't know about moral injury and its impacts?
Moral injury is a relatively new concept, okay? And people have talked about it. Actually, the first person was sort of a psychiatrist that I'm going to be, and I'm looking forward to in a panel discussion with in August. He was sort of the first person to start seeing this in Vietnam veterans, so 40 years ago. But the thing is, it just really hasn't got a lot of empirical research, okay? So it was only really recently that people started, with veterans coming back from Iraq and Afghanistan and other countries. This is certainly not unique to U.S. veterans, okay? There are groups in Europe and there are groups in Australia that I'm familiar with that are doing very similar kinds of research, finding very similar kinds of findings. So, but I think really expanding the concept of moral injury to other professions is really important. And as you kind of mentioned earlier, Alan, just different domains. And as the caller mentioned, I mean, there are certainly different domains in life where I think we can apply something like moral injury to people that maybe perpetrate other kinds of acts. And I know this is something that we don't like to think about, but maybe if you're somebody that has been a physical abuser, maybe you were a spousal abuser, maybe constructs like moral injury, feeling guilt and shame, and learning techniques to help you, eventually learn to accept yourself and learn to, reduce your own feelings of guilt and shame about things that you've done. I mean, I think the sky is really limitless, open for research in the area of moral injury. And again, I don't think it has to be applied to even people in certain professions. Okay, and I know you and I have talked about this a little bit with what about people who experience child abuse? Okay, do they feel that they've been, morally injured? Well, I think you could make that argument. Okay, so, but I haven't seen again this construct really applied in different domains like that. Okay.
So one last question. We are talking before an audience that's international. We have students or we have participants from all over the world, all over the country. I think we literally got every single one of the 50 states. But let's say there's a student out there who wants to get involved in this kind of research. What opportunities are there, whether they're a high school student or even an undergraduate student at a different institution, to get involved in doing work like this?
Well, first of all, I think the best thing to do is email them, because I do have a lot of colleagues around the country that I know at this point, and maybe I could put you in touch with somebody locally. You never know. So I am the Society for Military Psychology. We have a moral injury think tank. And I'm, actually chair of that group. So there are just a lot of different groups around the country that are doing this work. So it might be possible for you to, link in to somebody who is doing that kind of research, hopefully in the area that you're in. But remember, with Zoom, right, these days, you don't necessarily have to be in the area, but I can certainly give you something to read just to give you a little bit better background if this is really something that you feel interested in. But then I could also kind of put you in touch with there are websites that talk about it, and there are also groups again around. It's not just this country. There are lots of folks, particularly there are groups in the UK and Australia and so forth, that are, and I think it's just broadening, to be perfectly honest with you, the beauty of this is it's sort of increasing exponentially. You know, almost daily you see a rise in the number of researchers that are interested in moral injury. So just email me is probably the best thing to do at this point.
Well, there are no new questions. So I think with that, we can give a wrap to this session. What I'll say is to the REYES audience, for those of you who are either watching live right now or watching at a different time, again, echoing what Dr. Kelly said, if you have any questions about her presentations, you can reach her at mkelly@odu.edu as presented on the PowerPoint. And I know that she'll be thrilled to answer whatever questions she can and guide you to get more involved in this area of psychological research. Thank you, Dr. Kelly, for your time and for this great presentation. On behalf of the REYES team, we appreciate it. And thank you, everyone, for attending.
Thank you. Thanks for having me. I really appreciate it. Okay. Take care.